Okay, we're live. Hello, it's Bill, the knee pain guru, and welcome to the Ask Dr. Beck show.
Hi, everyone.
Hey, Dr. Beck. Okay. How you been?
Busy.
Busy. Okay.
Yeah. Grass grows about 3 inches a day.
That's the truth.
Oh my.
Do you cut the grass for the llamas, or?
Well, there's only 2 of them, and they roam over about 5 acres, so there's no way they can eat all the grass.
Oh, okay.
They eat whatever they want. I cut the rest.
Okay. Cool. That's what I've been. We've been feeding the rabbits with the stuff that's growing. We pull it in the morning and give it to the rabbits, and they eat it.
Okay.
So we're figuring out some different systems here to see how we can work more efficiently.
Nice.
So instead of like cutting the grass and then buying stuff to feed the rabbits, we
cut the grass and feed the rabbits.
Feed the rabbits.
Yeah. Okay. Cool.
So instead of doing double duty.
Yeah.
But it's been good. It's been fun. You could also, with that deep mulch bedding system with the chickens that we have, we throw a lot of the weeds in with the chickens, and then the chickens eat that. So
cool.
Yeah. Okay. Let me see. We got a question here from Melissa. Spine injury from car accidents. Okay. Hello. It says, hello, my friend was in a rollover car accident. The MRI shows 2 bulges of 5 to 7 millimeters of C4 and C5. She is in a neck brace continually except for sleeping and will be seen again on May 23rd. That's going to be in 3 days. What do you think her course of treatment should be? Do bulges shrink on their own? At what point is surgery necessary? Thank you for your ideas. That sounds like a pretty serious one.
Yeah, that's a packed question. So let's unpack it in small chunks so that we can understand what's going on.
Do we need to bring up pictures?
Sure. Bring up a picture of bulging cervical disc, and that should make it a little bit easier to talk about.
Bulging cervical disc. Okay, here we go. Let's share the screen. Share screen. And is it coming up? Are you seeing it?
Yep. How about the one on the lower right-hand side?
This one right here?
Where's your... Yep, that one.
Let's see. And are you just seeing the one image in a large?
Nope. I've got the whole thing plus the one image. The multiple pictures plus the one image.
Okay, hold on a second. Let me change the... There's something with the tab thing. I gotta switch it. Stop sharing. Gotta share. Share screen. There we go.
Yep. Okay, perfect. Now, so let's get our anatomy down.
Mm-hmm.
So in the back of the picture, this would be the top. We've got the vertebra. So the vertebra is bone, right? It's in a kind of a T shape.
Mm-hmm.
So the thing sticking out the back is the spinous process. The thing on the sides, those are the transverse processes. Okay. And those are present in all of our spinal vertebrae, with the exception of the first one. And basically, the thing to remember about the vertebra is it's hard and it doesn't move. Okay. That's the key. Everything else pretty much in the picture is soft and squishy and moves. If we come forward in the center, that thing right there, that's the spinal cord. So basically, that's the big wiring harness that runs out of our brain. And at each vertebral level, we have the wires that go out to the organs, muscles, and other nerves and skin. So those are the little yellow things that appear on the side. Okay. Now, all of that theoretically is supposed to work normal. It's supposed to work without pressure on it. So now we come to the bottom of the picture. This, in anatomical terms, is the front of the person, or the front of the spine. And the stuff in the center where your cursor is, the bluish stuff, that is called the Nucleus Pulposus. So it's Latin, it's the center, it's the jelly inside the donut, if you will. The purplish stuff on the outside is the annulus fibrosus, annular meaning circular, and fibrosis, it's tough. So it's a little bit like Tyvek. Tyvek is the stuff that the envelopes are made out of that are soft, but you have to cut it with scissors. You can't tear it with your bare hands.
Right.
So this annulus fibrosus is pretty tough stuff. It keeps the annulus on the inside. Now, what we're looking at in this picture has gone past the bulge stage, but that's okay because it actually makes it a little bit easier to talk about. Right there where your cursor is, what we've done is we've had enough pressure that's come in such a way that we have disrupted the annulus fibrosus, the donut that's holding the jelly in. The jelly has come out, and the jelly in relationship to the tissue around it is acidic. So the moment that jelly touches the nerve gets irritated. Well, the nerve can't get away from the jelly. The nerve stays irritated. So now you have symptoms of an irritated nerve. You have pain. You have potentially loss of sensation or increased sensation. It depends a little bit on who you are as to how it reacts. But you can't get away from it. That's the key. You can't get away from a ruptured disc. The question for this particular person, for Melissa, was a disc that bulges. So we have to backtrack just a little bit in time. You get a bulge typically before you get a herniation or a rupture. And so the bulge occurs in one of two ways. It's a bulge that doesn't touch anything else. That bulge, unless you did an MRI, you're probably never going to know because it doesn't touch anything. The nerves don't send you any signals about what's going on. Second option is you get a bulge that touches things. And if it touches intermittently, so theoretically, when I move my neck, the way I move my neck changes the pressure on the intervertebral discs, and so it can make a bulge bigger or smaller, right? So if we have bulge, and I'll call it the intermediate size bulge, no problems. When I'm like this, I might be okay. There's some kind of sensation when I go this way, and when I go the other way, the sensation diminishes or goes away. Well, those things, if doing this is part of your everyday life, okay, I might need to see a surgeon about it or get it treated. The third option is a bulge that is big enough that it begins to put pressure on the nerve. And that bulge would be big no matter which direction I go into. I can't make it small enough to stop putting pressure on the nerve. A little bit of pressure on the nerve makes the nerve swell over a period of time. And so now, same size bulge, but a bigger nerve, I have more pressure and have symptoms that develop. So that lays the foundation. Okay. Now we go back to the question, which is, what can you do for it? And so my first question for the person who was in the car accident is, well, do you have symptoms? If you have symptoms, then it's something that we need to get addressed relatively quickly, let's say within a couple of weeks. If you don't have symptoms, we have time. We can figure out more potential solutions to help with what's going on. All right. So now I'll take you through the things that I'm aware about. Keep in mind, this is not an exhaustive list, but it covers the big things.
Mhm.
In order for this disc, pardon me, to bulge, we have to have exceeded tensegrity.
Mhm.
So in tensegrity system, the body is self-supporting. There theoretically is no pressure or weight on that disc, so it floats in space between the vertebrae. It is a fail-safe. It's a backup. So that tells me that either in this accident or prior to the accident, something had happened to cause the body to need to go to the backup system, to the intervertebral disc. So they make this thing called a decompression table.
Okay.
And basically, what happens is we strap you in. It resembles a very modern version of the medieval rack.
Okay.
And so we strap you in, and the table very precisely puts in traction. The traction is designed to take the pressure off the disc.
Mhm.
And we do that in a pulsatile fashion. We pull a little bit, we relax. We pull a little bit, we relax. We keep that up. And the theory is over a few sessions, the pressure that's on that disc goes away. As you take the pressure away, it literally sucks the bulge back in.
Okay.
Now, it works for some people, doesn't work for others.
Mhm.
That's option number one. Option number two is to restore the tensegrity system.
Mhm.
You would come to see someone who is skilled body worker, right? And it could be osteopath, chiropractor, massage therapist, doesn't matter. Somebody who knows what they're doing. And they work with the body, get the tensegrity system restored. The tensegrity system then literally lifts the vertebra off of each other, which
Mhm.
takes the pressure off the bulge and does the same thing as the decompression table. We just do it without the need for the table. Um, Third option is surgery. Well, let me say physical therapy. Physical therapy would be done before surgery. If the physical therapist is aware of the tensegrity system, you can get some pretty amazing results.
Mhm.
Uh, if they're not, then my experience is the results are hit or miss.
Mhm.
If the physical therapy doesn't work, surgery is an option. Theoretically, then the surgeons would go through and they would put in something like a plate to create more space between the bones and give that intervertebral disc space again rather than being compressed.
Hmm.
Okay. That would be last option for me.
Mhm.
You can do injections. So in this case, if you put the needle in the right place, steroids can be an option.
Mhm.
Steroids are an anti-inflammatory. Um, in the case of a bulging disc, if you could get the needle to the right place, and it's a really tricky area because we've got the spinal cord and the nerve roots coming out, but if you can get the needle to exactly the right place, you could do prolotherapy.
Mhm.
Okay. And that is, I know that it can happen. That's a step above my skill level. I
Mhm.
probably wouldn't try that, but it is a possibility.
Mhm.
Acupuncture can begin to move the energy, take the swelling away. This is something where anti-inflammatory diet isn't going to hurt. It may not mean that you take away all the pain, but even if you could reduce some of that inflammation by 5, 15, 20%, whatever it is, you're going to get symptom improvement.
Sure.
Okay. So that's it.
There was one. It reminds me. I had a wasn't a rollover accident, but in '93, I had I shattered a windshield with my head,
Okay.
and there was a lot of compression in the discs, and my neck had
Yes.
concussion, really bad concussion.
Yep.
And there was a chiropractor, excellent chiropractor in Toledo, Ohio, that massaged my neck for about 45 minutes and then did something akin to what I see. They talk about this Y strap, like this
Yep.
chiropractors use this Y strap, and it essentially accordioned my neck and
Yep.
stretched everything out from halfway between my shoulder blades all the way up
Yep.
to my skull, and the relief was significant and immediate. The nausea went away, like all of the symptoms of what I was dealing with. Now I know that is in the direction of a decompression table, but a more
Yep.
aggressive version of that.
Yes.
Thoughts?
Yep.
Perspective?
So I'm going to take you back to my view of what's going on there.
Mhm.
So I will say that the experience that you had is one way of dealing with it.
Sure.
When we talk about sacrum for us as osteopaths,
Mhm.
sacrum has 6 axes. Okay.
Mhm.
And the axes that the 6 are less important for this part of the discussion. But what we don't talk about is that the sacrum sits in between the hips.
Right.
When we talk about each hip, with the total bone we call the innominate, it's made up of 3 bones,
Mhm.
can move up or down
Mhm.
in relationship to the sacrum, which is the bone that's in the middle. Well, we talk about the hips being able to move in relationship to the sacrum, but not the sacrum being able to move in relationship to the hips.
Mhm.
Okay. So for me, I find that people with a neck like what you described
Mhm.
often have the sacrum that has been driven down toward the feet.
Okay.
Okay. Conversely, the sacrum can be driven up toward the shoulders. It gets stuck in between the hips. And because then the sacrum either pulls on the head, pulls the head into the shoulders,
Mhm.
or it pushes the shoulders up into the neck.
Mhm.
What happens is, from my side, when you try to move the neck sideways, it
Mm.
goes click, 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 like a ratcheting wrench.
Mhm.
And to me, that says, hey, I got to treat the sacrum.
Mhm.
Far more gentle, also quicker than what you described, and same results. At the end, the neck becomes more supple
Right.
because we remove that compressive force. So that's my approach in using the Tensegrity system, for example.
Mhm.
It sounds like what you had, again, it worked,
Sure.
but a different approach.
Sure. Yeah. I at that time, that was
Oh,
the
yeah.
best I knew. I mean,
Absolutely.
that was pre knee injury, pre orthobiotomy. I
Yep.
had no awareness of that, and I thought that it was
Yeah.
amazing
Yep.
experience. Amazing meaning like I thought I potentially saw God.
Oh, yes, absolutely.
There was this. It was so painful, but it was so quick, and that was a time where I had more faith because uh, insurance was involved,
Yep.
and the insurance wanted me to go to physical therapy, and I knew from my own personal experience, it's like physical therapy wasn't going to touch what I had going
Sure.
on, and
Yep.
I needed something more specific,
Yep.
and that was well, that could be the it
Yeah.
was along my path of doing things that weren't the conventional medical model.
Sure.
But yeah, so great. That was actually there was way more options that you were offering than I had ever even thought
Mhm.
of. So that
Mhm.
was fantastic. Okay, let's see. Okay, we are back. Anything else you wanted to add?
No.
Okay. And we aren't getting any questions that are coming in from those that are watching. If you do have questions, please put those in the comment section or the live chat, and we'll review them on future Ask Dr. Beck episodes. Um, think that's all we're going to cover for today.
Cool.
So, okay. Well, thank you, Charlie.
Absolutely, brother.
Appreciate you very much, your expertise, sharing your knowledge with us. This is Bill Paravano, the knee pain guru, on behalf of the Ask Dr. Beck show and the Comella Foundation. Thank you so much for being here. Have a wonderful day, and we will see you on the next one.
Have a good week, everyone.